speaker, Esther Sukita. Welcome everyone. Good evening. Today we have Esther Sukita with us. She is going to be our main speaker today. I am Manju, and I'm going to be the moderator for today. Esther Sukita is a dedicated and experienced consultant psychotherapist with over 8 years of practice in the field of mental health. Esther holds a master's degree in Counselling Psychology from the Rajiv Gandhi National Institute of Youth Development, Chennai. Her specialization lies in child and family therapy, and she is trained in evidence-based approaches, including CETA model. She has extensive experience working with students, parents, teachers, and young adults, having conducted over 1,000 workshops and 500 training programs, and offering more than 7,000 hours of individual therapy. Esther's area of expertise includes stress management, emotional regulation, relationship challenges, substance addiction, and family dynamics. She has served as a consultant with Johns Hopkins University and has worked with organizations like World Vision, providing valuable mental health care and training. Fluent in both English and Tamil, Esther brings warmth, insight, and a deep commitment to promoting mental well-being. We are honored to have her with us today and look forward to learning from her and from her experience and wisdom. After the talk, we will also have a Q&A session with her. Please be ready with all of your questions. Yeah, over to you, ma'am.
Thank you. Anju, that was quite an introduction. I hope I'm not setting expectations too high. I'm just here to talk a little bit about mental health, and I have a few slides. I'm just going to share my screen. Before we got into this, I just wanted to share that if you have questions, feel free to also stop me. You can also put it in the chat, and I request Manju to also stop me if you need me to add something, if you would like for me to clarify a point.
Sure.
Can everyone see my screen?
Yeah, I can see the screen.
Yeah, I can see.
Yes, ma'am.
Okay, so I'm going to start with asking a very simple question. What do you think when you hear the word counselor or psychologist? What comes to mind? I'm sure you've heard, right? So what comes to mind?
A person we can get help from.
It's a very good answer. A person who can get help from. What do they do? What does a psychologist do? What does a counselor do? Typically, they say they talk, right? You go and they will talk and they will give advice. I'm going to try and change that today by asking you also to talk. So please do participate and have your comments ready. And also whenever there's a pause, I would like for you to chip in with what you think as well. Right, so we're going to start with today's topic on nurturing mental health and disability. Can I have people in the group share what your understanding of mental health is? What do you think mental health is? What are some things that come to mind?
A sound mind.
Sound mind?
Being happy.
Being happy, great answer.
To have a better understanding of ourselves.
To have a better understanding, to have self-awareness, great.
Emotional stability.
Emotional stability.
Being able to do everyday tasks.
Being able to do everyday tasks, function, yes, absolutely. Also, quick question, is everyone comfortable with English? இங்க யாராவது தமிழ் பேசுறவங்க தமிழ்ல பேசினா பெட்டர் அப்படின்னு இருக்கவங்க யாராவது இருக்கீங்களா? Okay, we'll stick to English. Okay, any other responses on mental health? Even what you've heard, it doesn't have to be a definition, what you've heard. Here, everyone, I think, are stakeholders, interested people, working with people with disabilities. So you can also speak in the context of that.
For me, mental health includes a good physical health too.
Absolutely. I feel like everyone's going to cover all my points. Right. So we'll go on to what we're exploring today. We're going to talk a little bit about what mental health is. We are going to talk about disability and mental well-being. I'm going to cover a bit about common mental health problems and what contributes to it. We will be touching slightly upon caregiver mental health and also how we can start taking care of our own mental health and as well as help others. So I will spend about the next 20 minutes, I think, going through this. But again, feel free to stop and I have questions come up. So, like all of you pointed out, mental health is something that is closely linked to other spheres of health. So, there are a few sections that I'm going to talk about, which is physical, spiritual, emotional, social, and mental. When we typically say mental health, we are trying to cover a bit about social and emotional, while understanding there is a link to physical well being as well. So when we say mental well-being, sometimes it's understood just as the absence of illness. If I don't have illness, then I'm mentally well, which is not entirely true. There should be absence of illness as well as presence of well-being. So someone said being happy, right? That's a very good point. So it's not just about not having a fever, but it's also about feeling good about yourself physically. Similarly, for mental health, it's not just the absence of illness, but it's also the presence of well-being. And what good mental health looks like is an understanding that we are to gain when we want to work on our mental health. So, what does a good mental health day look like for me? Can someone answer? How do you understand that I feel good mentally? What are some ways you can figure that out?
I'm able to think clearly through my daily routine.
Great answer. You're able to think clearly. Cognition is good. Anyone else? What does a good mental health day look like?
Waking up with the feeling of I'm good to start the day.
Waking up feeling good, feeling maybe even interested in the day, wanting to explore parts of your day. What could be the opposite? What's a bad mental health day look like? How do you notice if you're not feeling mentally okay? What are some indicators?
Not able to think clearly.
Okay, not able to think clearly,
Lack of motivation.
Well,
lack of motivation,
maybe feeling upset for some small things.
feeling upset by small things, triggers take up some emotional space.
Probably feeling numb as well, just zero emotions towards anything.
Feeling a sense of numbness, not being able to emote to anything, both positive and negative. Anything else? Bad mental health day. How do you notice? Maybe in how we respond to people, maybe it affects our function, and so on. What about mental health care? So, when we say mental health care, what are some things that come up? Of course, there are care professionals like psychologists, doctors, psychiatrists. What else comes up in terms of mental health care? When we say physical health care, we often think of how do we address diseases or how we might go work out, do things that help us feel good physically. What about mental health care? Can you share what it means to you?
I think when I'm able to take some time off for myself or just some quiet time would help me.
Taking some time to yourself to reflect, like a break, even. What else?
Doing art helps me.
Doing art. That's a great answer. I'm hearing a lot of voices again and again, which I'm not complaining about, but I would like to hear from the others in the group as well. Mental health care, or how do you take care of your mental health? What are some ways?
Talking with a friend.
Social support, talking with a friend. Great. So we also talk about mental and emotional health as the way in which you live life to the fullest. So if you're able to function at 100% and mental and physical and emotional health is not okay, it's not going to happen, right? So whatever contributes to you living life the way that you can is very important. That's what we're going to talk about under mental and emotional factors. So somebody also talked about this, where happy and healthy bodies along with a happy and healthy mind is what leads to a complete and holistic picture. We're going to talk quickly about disability and mental health. And I just wanted to share, when I was preparing for this, I tried to look up some statistics and put down some data. But unfortunately, that's when I think it really hit me that there is very less investigation and research done in the sector of disability and where it intersects with mental health. However, there are a few things that we do understand. I'm going to talk about this very soon, and then we can move on to some of the common mental health problems. So we understand from some small research that has happened that there's an increased risk of mental health, both disorders, conditions, and issues in the sector of people with disabilities. This can be attributed to multiple things, including compounded challenges in mental health care. So for starters, when we think of mental health care and we think of getting help from an external source, like for example, a doctor, we already know that access to mental health in general for any lay person is difficult in a country like India. With the compounded challenges of disability and accessibility that is reduced due to disability, mental health care becomes almost inaccessible. There is also limited access to understanding. We, being the people that have so much of exposure to content, who's able to look things up, who's able to get people to talk to us about this, we also have sometimes a very limited understanding. Persons with disabilities struggle with an even less understanding of what mental health looks like. Lack of social support. I'm sure we all know that social support is one big area of concern for persons with disabilities. I read about a study that said that when they could dedicate spaces, like even accessible physical spaces for persons with disabilities in educational institutions, it increased general mental well-being. So we know that the lack of social support plays a role. Communication. When it comes to communication, not just about language, even non-verbal communication and language in terms of sign language. A lot of professionals understand or use sign language, which could be a barrier for mental health help. And specialization and contextual understanding is severely lacking. So when I did my master's and my bachelor's in psychology, we had one paper that talked a little bit about special populations and very briefly addressed disability. Right? So there isn't much specialization or contextual understanding to mental health in persons with disability. And of course, finances, that also includes access to care, support, medication if required. So these are the intersecting points of disability and mental health. Let's talk about common mental health problems. So when I say mental health problems, what are some terms that come to mind? You might have heard and might have even used some of these terms. You're not going to be graded. I'm not going to say if it's a wrong answer. Can you just share what are some terms? Mental health issues or disorders or conditions, what comes to mind?
Anxiety,
One of it is schizophrenia.
Schizophrenia, somebody said anxiety,
depression,
depression, anything else?
panic disorder,
A sense of
Panic
sense of-
disorder,
a sense of insecurity.
a sense of insecurity, yes. Anything else? Any observations on what you think you have seen in persons with disability? Or even in yourself, if you're okay to share.
Phobia.
Phobia,
Lack of confidence.
lack of confidence.
Financial crisis.
Financial crisis, I would categorize, that's a good answer because I think it causes stress. I would categorize it under factors that lead to mental health conditions or issues. That's a very good point. Someone else also had something to share, I think. Okay, we'll move to some of the common mental health problems. I've tried to categorize this in something that we can easily probably see or we could have come across for ourselves or in people around us. So, depression characterized by a very low mood or a feeling of sadness, helplessness, and hopelessness. So, usually, when there is depression, the person feels that there is no scope for their life to improve. So, because of which they feel really down, their emotions will always be on the negative side. And they also have a sense of they cannot be helped. So, depression is, we can categorize depression as maybe mild and moderate and severe. When it moves to a severe spectrum, we would require more intense intervention, but we might notice mild depression even in ourselves, depending on what we are going through. Anxiety is characterized by uncertainty and fear. So there is fear regarding something that is uncertain. So there could be anxiety about the future, anxiety about stability, anxiety about how relationships will work, anxiety about even events and programs, anxiety about performances. So anxiety is also something that we could commonly see even in ourselves. And again, when it becomes severe or when it becomes to a level where it stops someone from functioning, we would require a bigger or more intense intervention. Stress and coping. So here I'd like to bring an example. So stress is a very normal emotion. We all feel stress. We tend to feel stress at an everyday level. Sometimes stress is very minimal. Sometimes it's very profound. So when I say minimal stress, it can be an example of I woke up late and I am now probably running late for some commitment. So I am rushing through my everyday activity in the morning. That could be mild stress. But I still have a sense of pressure and stress that's in my body, in my mind, but it is minimal. Profound stress or something that could be higher intensity would be I have lost my job. I don't know how I'm going to manage my finances, or I have an issue at home which is occupying all my time. So this is how we can categorize stress, and stress does not work the same for everyone. So what I mean when I say that is something that could be highly stressful for one person can be minimally stressful for another person. One person could feel really stressed out by being late. Another person, it could be the norm and it doesn't affect them at all. And how you cope when you have a feeling of stress is very key. So, when we talk about coping, it's our way of trying to manage with the difficult emotions. We cope with other things also, not just stress. But I pointed this out here because that could be a mental health problem. So, coping that is done in an unhealthy way, for example, shutting down, not wanting to share, not wanting to talk about it, doing things that maybe give you relief in that moment but is actually more harmful to you. I'm going to use that as a segue to the next point, which is substance uses, where there could be substance that is used because of stress or because of any of the other mental health problems, but it becomes your coping. So there could be tobacco or even hard drugs and alcohol, very common in our country. Again, behavioral issues also are very closely linked to mental health problems. For example, how a person responds in emotions. Emotions are very common. We all have emotions including being sad, being angry, being upset, even feeling like we are being threatened, we are being targeted by people. But how we behave in those moments can become mental health problems. For example, behaving in a way where I am aggressive towards someone else, I'm abusive, I use violence either towards myself or someone else, can all be mental health problems. I'm going to pause here to ask if anyone has any questions or anything that you would like to add under common mental health problems. Any questions, comments?
I just have one question. Does substance issues like eating tobacco or drinking alcohol, they enjoy it? So does it, maybe some people, because of issues, they might take them,
Right.
but most of them will take to enjoy their, day or sometimes. So how do
Right.
you,
Great
it is
question.
considered as a common mental health or something like that?
Sure, that's a great question. So let me give you the distinction. When it comes to substances, there is something called use, there is something called abuse, and there is something called dependency. So when there is use, it could be social use, where people drink when they meet for a celebration, or when they might share a smoke when they're talking to people, or even by themselves. That would be use. Abuse would be extending the use in a way that inconveniences either their body or their life or their performance or their function. So that would be abuse. Dependency is where it links to mental health problems. Dependency is where if I'm not using that substance, I feel withdrawal, where I have physical, emotional consequences because I'm not using the substance. So, for example, I'm using alcohol every day and I'm not using alcohol today, because of which I'm not able to sleep, or I get very irritable, or I am having a physical reaction because I don't have alcohol, where I am either having tremors, or my body is, I'm sweating, I'm having signs and symptoms of stress. So that would be dependency. Abuse is more or less subjective, but dependency is very clearly marked by emotional and physical markers.
Right.
And I think the norm for using this under mental health problems is that when it's used, it's very hard to maintain a fine line, especially for hard substances, because the substance has a nature of addictiveness. So it's very hard to just use and not abuse or go into dependency. I hope I've answered your question, sir.
Yeah, thank you very much for the explanation.
Any other questions from anyone else? Okay, we'll move to some of the contributors for mental health issues or conditions. Internal contributors are self-concepts. So anything that you all shared as starting with self. So we spoke about that a little while back, and it said self-confidence or self-identity or esteem, anything to do with yourself. Understanding yourself can lead to mental health issues if there is a severe deficiency. For example, if I severely lack self-confidence, I do not feel that I am capable of doing anything, or I think I'm not worthy, I don't have a sense of significance to my own self, it can lead to mental health problems like depression, because I start to feel I am useless and I don't have any value. And it can shift into feeling sad, feeling upset about it, and I could get into a spiral there. Is lack of purpose. If I don't have something that contributes to my life meaningfully, either a job, a relationship, a friendship, even a area where I shine, an ability that I possess, a method in which I feel I contribute to somebody else, I may lack a sense of purpose, which will contribute. Identity, having questions about my identity. Who am I as a person? Where do I belong? Who am I contributing to meaningfully? Where am I able to use my entire self? If I don't have clarity regarding this, that can also contribute. Lack of acceptance, and this is something I would like to make a note, is a very key contributor for people with disabilities, because acceptance means complete acceptance, not just acceptance of what they are able to do, but also acceptance of who they are, including their disabilities and what limitations come along with those disabilities. Regulation, if there is no self-regulation of emotions or thinking or behavior, it can contribute to mental health issues. And of course, as someone rightly pointed out, physical health. If I do not have good physical health, it can contribute. If I am feeling sick, if I don't have good sleep, rest, or hydration or food, it can contribute to my mental well-being. External contributors include relationships, any concerns, conflicts, issues within relationships. It can be relationships with your parents, siblings, friends, with your spouse. Any relationship can cause and contribute to your mental well-being, both positively and negatively. Finances, the lack of finances also for persons with disabilities can quickly become connected to independence, and that can contribute to mental well-being. Lack of opportunities or shunned opportunities because of disabilities, especially in the sector, is a huge deal, and it can cause mental health concerns. Discrimination, stigma, sidelining, any sort of unfair treatment towards the sector definitely causes mental health concerns. abuse need not be explicit. Sometimes when we think of abuse, we think of someone hitting somebody or actually causing bodily harm. That is alone is not abuse. There's verbal abuse, there is very internalized abuse where it might not show up as explicit words and language, but it can still be the treatment of a person. For example, this person will be at home, but they will not be considered a person who's belonging to the family, right? So they will be left at home for events or programs, or they will not be considered as part of the census even at certain points. So these are all contributors for mental well-being. History and genetics, some of the things that somebody had talked about schizophrenia, which has a genetic component to it. Some mental health conditions, especially, or disorders, are passed down, and it definitely has susceptibility involved. Access to support and care, which is also very external, is a cause for and can be a contributor to mental well-being. Any questions, reflections on both the contributors, the internal and external contributors?
Ma'am, what about accessibility? Sometimes
Yes.
like if they are wheelchair users.
Absolutely. So yes, accessibility to support and care. For wheelchair users, unfortunately, a lot of areas do not have accessibility, even in a physical sense. And it can also be more than just physical accessibility. Right? So that's a very good point. Anyone else has anything to share? Okay, we'll move to care for caregivers. Can I ask the group, how many of you in the group have either given care, provided care, or it is your primary role to provide care for a person with disability? It's part of your work. Anyone here? Or do you know someone who is a caregiver?
Yeah, we work among people with disabilities. We consider caregivers are the abled people who assist their person with disabilities in their families or in their community. Basically from family, I can say.
Great. Thank you, sir, for sharing. So for
Yeah.
caregivers, it's very important that they recognize that they are also human. And as long as you're human, your mental well-being and any issues around mental well-being is definitely evident. So we will have to talk about having enough to give to someone. So when you say caregiver, they give. And if they need to give, they need to have, right? So we should be aware that they're not pouring from an empty cup. There's nothing to pour. If you're pouring from a cup, it should have something. Right? So
Sorry to interrupt, but I
yes,
would like to say that it is caregivers are. I mean, if there are caregivers also, I'm sorry to say, uh, caregivers are very expensive. So most of them cannot afford it. So they have to depend on their families, and their families have no time to give them. I mean, supposing a wife is met with an accident or a husband has met with an accident. So someone has to be the breadwinner, right? So they have to leave the house and go. So it is very difficult, very, very difficult. And then you don't get the care. Sometimes the caregivers ditch in the right time. So it is
yes.
very difficult, especially for spinal cord injury, where there are paraplegics and quadriplegics who are completely dependent on caregivers.
You're absolutely right, ma'am. And I think you're talking about having someone employed as a caregiver. I'm using this term a little liberally. I'm using it also for instance, in the example that you meant, I would call the wife the caregiver, right? Because they are the primary source of care if there is no external employed person. And for them, they also need to have enough to be able to give. So in the example that you spoke about, if they have to go and earn out there, they're working a 9 to 5, they may not have enough to give. And that causes concern for the mental well-being of a person who has the caregiver role assigned, because they are part of the family, because they have a spouse, they have a sibling, they have a child who has a disability, but unfortunately they don't have enough to give themselves. And along with other factors, including not being able to express frustration, right? There are many of them. I'm again wanting to clarify that when I say caregiver, I mean the person in the family or someone who's assigned the role, may not be an external person or someone who's being paid to do it. But somebody who has to take up that responsibility, even like ma'am just shared about spinal cord injury, people with injuries who are unable to move or even care for themselves at a basic level, who are dependent on someone else. This would mean the person who is in that position might also find it hard to share frustration, right? They might not be able to or might not be willing to talk about what they endure or what their personal journey is, or even at times the inability to understand and empathize entirely with the person with disability. They may face burnout. They may also have their personal concerns and issues. So they also have their own relationship with mental well-being, and that can also be a concern. I'm going to rush past the next couple of slides because I want to take more questions, especially if people have them. Taking care of your mental health has to be intentional. You'll have to acknowledge the importance of it. And it's not just a means of avoiding mental health problems, but like we spoke about, to foster a better and positive and happier state of mind. I'm going to talk about 4 things that are very important. So you can make a note. I'm also happy to share these slides for reference. Sleep 7 to 8 hours a day, regulating sleep by fixing a time, a place for sleep, have a sleep routine, allotting time for thoughts if thoughts are what is keeping you awake, avoid any stimulants, including caffeine, sugar, or anything that stimulates you cognitively before you go to bed, and do not break the cycle. Rest is not the same as sleep. At least 15 minutes of a day to do nothing, where there is no mental occupation, you're not contributing to anything. You can fill it with music if you find it restless to sit with doing nothing, or you can do meditation or any spiritual activity. Food and hydration, essentially 3 meals a day, if possible breaking it down into 4 or 5 smaller meals like a snack or even a tea or a coffee. Healthy food versus comfort food, identifying what is healthy and what contributes to your physical well-being, because like we said, physical well-being contributes to mental well-being. Recognizing when you're using food as a coping mechanism. If you're someone who relates to food at an emotional level, you may not feel like eating if you're having a bad day, or you might overeat when you're feeling stressed. So recognizing these patterns and creating healthier food habits. 2 liters of water per day for hydration. Mental and physical activity, 30 minutes of movement per day. Very intentional, very planned movement. Not that we end up moving anyway, but just planning to move. It can be a workout, it can be walk, it can be anything, it can even be dance, whichever is okay for you. Thought experiments like cognitive exercises. It can even be an external exercise like you're reading the news, observing some new information, listening and reasoning in your mind. Routine building. I'm rushing past this, but I'm happy to explain if there are questions. The importance of routine is that when you have a routine, it helps you monitor your mental health. You will recognize mental health is taking a dip if there is a break in routine, if something goes wrong, and if you are facing a crisis situation, a routine is also how you fall back and manage and cope. Mental health tasks, I would like for everyone to make note of. This is something that I would like for everyone to try when you're back after the call. Check in with yourself, ask yourself what mental health means to you. How do you identify what a good day, what a bad day, how you feel mentally, and how it contributes to other parts of your life. Personal activity, 1 per day, right? Either journaling, someone mentioned art, music, any sort of hobby. 1 social activity per day. It can be talking to someone. You can use different ways in which you check in with somebody else. It can be a long conversation. It can be a quick chat. It can be a text. But having 1 social activity, 1 happy activity. So choosing 1 thing that contributes to your mental state and emotional state by making you happy. It can be a 5-minute, very quick activity, but dedicating 5 minutes for this every day. So this is a very quick mental health checklist that you can follow. Getting help. When do you get help? When there is mental health issues. If there is dysfunction because of mental health concerns, your function is being stopped, like you are unable to work, unable to perform, unable to have conversations, unable to take care of your own self. This is when dysfunction is evident. That means you need to get help. Safety, when there is concern for someone's life or well-being, either there is self-harm, hurting yourself directly by using an object, or indirectly by starving yourself, by not taking good care of yourself, by avoiding medication. Any of this would be self-harm. Suicidal ideation, wanting to die, wanting to disappear, wanting to not live anymore, not being able to think beyond a point of your life. and consistent negative symptoms. So we talked a little bit about what common mental health issues can look like. If it's very consistent, if it doesn't die down in intensity, or if it builds in intensity, you will get help. Whom to reach out to? Mental health professionals, including psychologists, counselors, social workers in psychiatry, psychiatrists, even normal doctors can point you in the right direction, and mentors. So this is, I know I rushed to the last few slides. Happy to go back depending on what questions come up. So I'm opening up for questions and any reflections. You know what they say about no questions, right? It's either you understood everything or nothing. I will assume that later if you do not ask questions. If there are questions that you'd like to ask but not want to open up in the group, feel free to send a chat text.
No, I would
separately.
like to ask a question.
Yes, please.
What can a disabled person do when he or she is in frustration? You know, there are certain times you accept life as it is, but there are certain times that disappointment comes in. Like,
Yes.
you know, attender is not there, or when you want to do something and you're not able to do. So that time there is a lot of frustration.
Yes. You're right, ma'am. That's absolutely true. It's actually one of the very, very common emotions that persons with disability face. I would categorize this into two. I would look at it as just in the moment, short lived frustration, which any human being is completely entitled to, right? Even we get frustrated as people with able bodies when there are inconveniences. And it's a normal human emotion that we endure. We get frustrated, we find a way to cope, or after a particular amount of time passes, we feel a little better about it. If it's short term frustration, all I would do to support is hear them out or understand and leave it at that. But if it's deep rooted frustration, or frustration that they are tapping into whenever there is even a small inconvenience, it taps into the larger picture of I'm unable to do this, or I'm not capable, or this is not happening for me. And even rooted in other feelings like resentment, bitterness, I would explore it very differently. So that would look like two ways where I try to remove the cause for frustration. It could, I'm not talking about removing what the reality is, acceptance of reality, but removing the cause, meaning the perception of it. So let's say they view the entire situation as a burden, as an unfair treatment, or a perception that's causing the frustration. We'll try to shift it either with therapy or counseling, or just by sharing experiences, building the support, and we try to shift that. Or the other way, where we want to look at how they can channelize that frustration in a different way. Though I'm feeling frustrated, though there is a deeper frustration, because I cannot change the cause, or I'm not able to alter the perception, I will use a different way of channelizing it. I will pour that frustration into something else. For example, when I identify I'm not able to do this and it's huge, very, very frustrating to me, I find a means of choosing to do something that is able for me. I am able to contribute to it, and I channelize that energy here. Both of this is a good option, but usually done in a counseling setup. We could also explore how this can be a theme of discussion for a group of people so that everyone can do it together.
Thank
I
you.
hope that answered your question, ma'am.
Yeah, thank you.
Thank you for your question. Any other questions?
This is something personal question. Yeah, like I've been working with children a lot, and like because they are in this field, may know like a little bit about yeah, what's mental health and how we go about it and all. But like recently, I've seen these like so much of fear in my child. Okay, like my older daughter Asha, she's just scared for everything. Okay, so now I'm just like sometimes I get confused. Is this anxiety or just like a normal fear? So where do you draw that line between some problem with mental health, or like it's just normal childhood? Where do you draw the line?
That's a
Or
great
how?
question. Yes, I have a couple of ways in which you can do it as a parent. This is not as a professional, but as a parent. you could see if this is causing them to shut down parts of themselves. For example, you might understand a bit about your child's personality. An example would be if your child is someone who is happy to explore participating in a competition, but the fear is something that is to the point where they deny and they do not want to explore it, and they say, I will not participate because of fear, or I will not take part because I'm too scared. I would use this as a first marker, because it means that that's something that the child can do and is capable, and would be in under normal circumstances be willing to try. Personality wise also, they will be willing to try, but the fear is masking that, and that is something that they are not able to overcome. So this would be my first marker. The second marker, I would also identify to see if it is the general way in which they operate, or is it isolated to certain particular events and eventualities. For example, do they not have the same level of fear when they are in a close circle, when they are among their friends, when they are in a particular place where they feel safe and comfortable? I would then look at it as they have created safe spaces where they do not have fear, but there are spaces that they have not explored and they have fear. But if it is universal, everywhere they have the same level of fear, it can be within close family members, it can be in other community places, that they also exhibit the same level, then I would use that as a second marker. So one, if it causes them to stop themselves from doing things. Two, if it is universally, if I see that happen everywhere. Did that help, ma'am? Would you like a little bit more information around this?
Yeah, maybe. But
Okay.
yeah, like this helps. But I just have a few more questions. Maybe I'll ask that later. I'll let
Sure.
everyone else. Maybe we can have another talk some other time.
Yes, sure. I actually would say that when it comes to personal questions, I would be able to, at a public forum, only give you very general inputs, but very happy to
Yeah.
connect one-on-one to talk more in particular to your case, because there will be factors
Sure.
that contribute.
Yeah. Thank you. Thank you, Esther.
But thank you for being so open and willing to ask, ma'am. Appreciate it. Anyone else? Questions?
My question is, sorry. Yeah, my question is, so often persons with disabilities are isolated, and usually they don't have the opportunity to mingle or interact with a lot of people outside their homes. So how do you think the people in the community can actually take steps to connect with that person with disability, or how they can actually include them in their lives? Their lives. Your
That's a great
ideas.
Yes, that's a great question. So what I think you're able to see that there is a lot of isolation, social isolation, and also I think at some level the person with disability also struggles to make connections because of past experiences. Right, so they may not have had safe and consistent spaces for them to feel like they can connect the same way as a person without disabilities. So what I would suggest is, one very key to this is consistency. Being able to show up in a way that is consistently seen by the person with disability to trust. That if you want them to warm up and build a connection, it has to come at the level of where they are able to trust us. And the trust is built only by being consistent in how we interact with them, because they might have faced situations, and this is something that I've noticed in some populations, where they have seen people come in for a short period of time or for particular reasons and leave, which might be a universal experience. We might have it too. For them, it leaves a lasting impact because they consider it even more of a sign that they need to be isolated, even more of a sign that nobody is going to understand or get me. So for us to show up consistently makes a difference. Another thing would help is to have genuine curiosity on the person's real being and not just their disability. So, for example, taking time to connect with them at the level of, who are you without the tag of a disability? What are your likes? What do you feel like doing? What do you usually do? Where are your interest areas? What do you like talking about? Without just the tag of, this is your disability. What happens because of your disability? Because this is such a washed out topic when it comes to conversations with them. Right? They may have many people having such conversations. That curiosity might be present in a lot of people, but when you're wanting to make intentional connections, the curiosity goes beyond what we are just seeing as a disability or a tag, but as an internal person and a being. So I think that fosters a sense of trust and openness as well.
Thank you.
Thank you for your question. There's someone else who also had a question. Okay, I think we are a little over time. Thank you for having me and for listening, and also for your meaningful contributions. I wish we had more to kind of explore some of these individual questions a little deeper, but I am available if you'd like to reach out. There's one question in the chat, so I'm just going to read out the question and answer. A person with disability, can burnout be categorized as mental illness? Mental illness is a very strong term. We do not use it for lightly. We need a professional to diagnose mental illness. I will categorize burnout as a mental health problem where they are completely exhausted, where they do not have any strength emotionally, cognitively, mentally to contribute to anything meaningfully. And I will treat it as any other burnout where they have to be recharged, right? So when we say burnout, it means you run out, right? So you have to recharge. And whatever needs to be given to that person in particular for a recharge has to be provided, be it a break from everyday function, be it sources of support that gives them feelings of energy, whatever else that they need. I wouldn't categorize it as a mental illness. And usually burnout does not stand alone. Burnout will come in with some other symptoms like feelings of depression or feelings of fear or feelings of inadequacy, which we will address separately. Any other questions, or I can hand over to Manju? Right. All right. Thank you. Thank you, everyone. Thank you for listening.
Thank you for helping us.
Thank you, ma'am. That was a very lively and very informative session you gave us today. I'm sure many of us are touched by it and have learned a lot. Thank you so much, and may God bless you in your career and in your ventures of supporting others. Thank you. God bless you.
Thank you. Thank you so much, sir, for your very lovely words. I'm very happy to be here and to just start this conversation on mental health. There is so much more that we can definitely uncover, and hoping that I can be of value in the next few events as well. I have one hand up from Amit, who happens to be my husband. I don't know if it's a question or just attendance. Right. Okay. Thank you. Back to you, Manju.
Yeah, thank you so much for being here with us today, ma'am. It was lovely to have you, and I think definitely it's an eye-opener for all of us. We learned so many things. Yeah. Sandeep, are we taking picture?
No, Manju.
No? Okay, sure.
Yeah.
Okay. Yeah, thank you everyone for being here with us today. We would love to.
One more suggestion, excuse me.
Yeah, sure. Yeah.
Instead of having private conversations, since no one knows each other, even if they know each other, we are all sailing in the same boat. Either somebody's child is sick, or father is sick, or the person is sick, or whatever. When one question is being answered, it may help the others also. It may be related with others also. So I think it would be helpful if it is an open conversation than private conversation. But it depends on a personal view of a person. Like there may be something which I may hesitate to ask. When somebody is asking is, I'll get my answer. It is my opinion. That's a personal view of everyone.
Thank you for sharing. I think what you're speaking of is where we can have like a group Q&A where people might be able to talk about their personal struggles in that particular situation, which other people might not be able to articulate or talk about, which I think is a good idea. Very open to something like that in the future. But also for anyone who would require a one-on-one or has specific circumstances that you'd like to discuss, I will let Sandeep sir also share my information so you can go ahead and reach me directly.
Okay, thank you.
Sorry, I lost my network in the middle.
Yeah, we are done, Manju. You can wrap up.
Okay, sure. Yeah, we would like to involve you in the monthly meetings, in the next monthly meetings as well. Please feel free to share your feedback about today's session. And if you would like to like us to cover any particular issues or topics in the future meetings, please feel free to reach out. Yeah, we will also keep you informed about the upcoming programs. Follow and connect with us on social media. The IDs and handles have been have been up in the chat box. Yeah, see you all soon. Have a pleasant weekend. Thank you once again, Esther ma'am.
Thank you. Thank you for having me. Thank you, everyone.